Alright, so we just spent a bit of time talking about glial cells in part 2 of chapter 14, going through some details associated with the 6 different types, which were astrocytes, ependymal cells, microglia, and oligodendrocytes in the central nervous system, and satellite cells and neurolemmacytes in the peripheral nervous system. Now then we started concentrating on myelinated versus unmyelinated axons, where we could see oligodendrocytes and neurolemmacytes, myelinating axons. We talked about how myelination occurs through the concentric wrappings of the cell around an axon, and now we're looking again at the differences in how impulses transmit through myelinated versus unmyelinated axons. We've talked about this in previous lectures, so this is mainly review. So as you can see, in the myelinated portions of an axon, the electrical voltage does not change across the membrane, meaning that there's no impulse being transmitted directly through that myelinated portion of an axon. Because remember that glial cells do not transmit impulses. So that allows the impulse to essentially jump from neurofibril node to neurofibril node along the length of an axon, whether we're talking about an axon of a motor neuron or any sort of neuron in the peripheral nervous system or in the central nervous system. And because it can just jump, these are quote-unquote jumps, from neurofibril node to node, that type of impulse transmission is referred to as saltatory conduction. That sort of conduction is a faster has a faster rate of conduction or transmission because it has less of the cell membrane to actually transmit through or to open all those gates through, although there's some discussion in current literature on whether or not that is actually happening. Supposedly requires less energy or less ATP than in unmyelinated axons because there are fewer gates that require that energy to open and allow the sodium ions through. Again, you could read more details about that in more current literature. And this is the type of transmission that's characteristic of the motor neuron axons that are transmitting impulses to skeletal muscles. So the rate of transmission tends to be faster to skeletal muscles, so that we have a quicker reaction time. In contrast to myelinated axons, if we look at unmyelinated axons, the nerve impulse transmission is referred to as continuous conduction because the impulse has to travel through the entire length of the axon, which is slower because it's not skipping from node to node. Because there's more ion gates that have to be opened by phosphorylation with ATP. It requires more energy for continuous conduction, and this is the type of transmission that's characteristic of transmitting pain stimuli, so that the sensation of pain occurs to us, or we become consciously aware of pain sensations at a slower rate than the impulse transmission that occurs to stimulate our skeletal muscles to contract. So this is a diagram showing an unmyelinated axon or set of axons in the peripheral nervous system, showing how the unmyelinated axons are actually sort of lying adjacent to or even embedded somewhat in close association with a neurolemmacyte, but the neurolemmacyte isn't concentrically wrapping around each of these axons. So that's demonstrated over here in this slide of several unmyelinated axons in close association with a neurolemmacyte, but again the neurolemmacyte isn't allowing the impulses to transmit by saltatory conduction. Here we're looking at an axon that is myelinated by a neurolemmacyte. And you can see the size, the diameter of the axon is larger as well, which also speeds the rate of impulse transmission. So that brings us to the topic of how axons in the peripheral nervous system can be regenerated following an injury or trauma. So axons in the peripheral nervous system are perhaps more exposed to damage associated with trauma, such as cuts or crushing injuries and other kinds of injuries. There we go. And so a damaged axon can regenerate, but with some time. However, regeneration requires a few things to be in place here. So first of all, regeneration of an axon in the peripheral nervous system depends on the amount of damage, how much of the axon is actually damaged. It also depends, as we'll see, on whether or not neurolemmacytes of this myelinated axon, if some of the neurolemmacytes survive, because they secrete nerve growth factor, which is going to be helpful for guiding the new growth of the axon. And it also depends on how far away the trauma is from the effector organ. So the closer the distance between the severed axon and the muscle, for example, the greater degree of regeneration is possible. All right, so we'll take a look here at the steps involved in this regeneration. So we're looking here at initially where the cell body is, or basically the motor neuron is shown. The cell body is located here. The axon is myelinated. You can see that it connects with a skeletal muscle fiber at these axon terminals, where each of these forms a neuromuscular junction. So that should be familiar terminology. And you can see where that this axon is myelinated by several neurolemmacytes. And there's where the trauma has occurred. So what initially happens is at the severed end, the proximal end of the axon sort of swells and seals, and then the distal end, distal to the trauma, the axon begins to degenerate. All right, and now we do have some fragments of neurolemmacytes that persist, which are going to be important in the next step, which is where those neurolemmacytes start to form what's called a regeneration tube. And the regeneration tube is formed by not only the neurolemmacytes, but any surviving endoneurium, which is that areolar connective tissue wrapping surrounding the axon. All right, if we go to the next slide, then we can see, whoops, the next step, which is in step 4. We're looking at the axon starting to regenerate and is guided by that regeneration tube. And as it's growing towards the effector, neurolemmacytes start to form again to remyelinate the axon. And eventually the axon reaches the skeletal muscle, forms those branches or axon terminals to reform those neuromuscular junctions, and reinnervates the skeletal muscle. So those are the steps that are involved in regenerating axons in the peripheral nervous system. Now, axons aren't readily able to regenerate in the central nervous system, for one, because oligodendrocytes don't release nerve growth factor, which neurolemmacytes do. So in that regeneration tube, those nerve growth factors are helping again stimulate the axon to grow. But in the central nervous system, the oligodendrocytes don't secrete that nerve growth factor. Also, there's so many axons in the central nervous system, they're so tightly packed together that it makes it difficult for regrowth or regeneration, because they're limited basically by space. And additionally, astrocytes respond to injury in the central nervous system by going in and filling that space where those neurons were located. And so astrocytes kind of are blocking essentially the axon regrowth in the central nervous system. Astrocytes also trigger an immune response, resulting in inflammation, which is going to limit regrowth of the axon. And then also the astrocytes, along with connective tissue coverings, will produce scar tissue, which then physically blocks axon regrowth. So treatment in for trauma in the central nervous system, usually to give any chance of regeneration in the central nervous system of those axons, involves giving a patient immunosuppressors to decrease the inflammatory response and to basically prevent those astrocytes from creating scar tissue, and then the patient's given antibiotics to replace the astrocyte response. But again, this is limited regeneration for axons in the central nervous system, and is a huge area of research for spinal cord injury, recovery, and so forth. We see an example here this happened a couple of years ago, but is more common, I guess, now at this point, where we had a veteran from the Iraq War who lost both of his arms, one distal to the elbow joint and one proximal to the elbow joint, and he received a double arm transplant, essentially. So in the diagram here you can see where various things would have to be reconnected. Here's the recipient, basically the person's remaining part of his arm, and the donor arm results in where they had to reconnect vessels. This would be reconnection of the cephalic vein, reconnection of the basilic vein, lining up muscles with tendons so that they could regrow together, and then creating nerve pathways for the nerves to follow to innervate the muscles of the donor arm. So it's a fantastically interesting area of treatment and recovery for people who have amputated limbs. So that brings us to a topic that we have discussed previously again, so this is a little bit of review. The structure of a nerve, which again is a bundle of axons, and nerves are only found in the peripheral nervous system. They are not part of the central nervous system. As we get into the brain and spinal cord discussions, we'll see that bundles of axons in those regions are called tracts. But here we're talking about still a nerve, which we only find in the peripheral nervous system. So for example, the radial nerve, the ulnar nerve, the femoral nerve, and so forth. Because these are bundles of axons, they carry both sensory and motor impulses. So think of it, remember, as a cable full of individual wires, and each of those wires is an axon, some of which belong to sensory neurons and some of which belong to motor neurons. So we'll have two-way transmission of impulses. All right, now like skeletal muscles, we have different connective tissue wrappings that help organize nerve tissue in the peripheral nervous system, or in the nerves. So you're starting with an axon, which in this case is covered with a myelin sheath, but then has an outer covering of the endoneurium made of areolar connective tissue with some so areolar connective tissue surrounding this axon. Then we see a bundle of axons here called a fascicle, surrounded by the perineurium, and the perineurium is composed of all of this here, of dense irregular connective tissue, and the perineurium also allows blood vessels to or capillaries to reach these individual fascicles and then individual axons, because the neurons need, remember, energy for impulse transmission. And then the fascicles are all bundled together here by the epineurium, again composed of dense irregular connective tissue, enclosing the entire nerve and providing both support and protection. And that, so then we can see sort of histologically the fascicle composed of individual axons that are myelinated, and in this longitudinal section we can see myelinated axons, and here we're looking at little individual neurofibril nodes, rather. And that brings us to the next topic on synapses, which is where we'll start the next video recording.